Thank you for joining me today for the Atrium Health Plant-Powered Nutrition webinar for personal well-being. This is Jill Ashburner with the LiveWELL team. I'm happy to present this webinar to you today. At the end of the webinar, you will receive information on how to enter credit for the Personal Well-Being Incentive Credit. If you are listening just for your own information, we certainly encourage you to do that. Remember, in order to get incentive credit for any of the webinars or any of the incentives that you're doing this year, you need to take your health survey first. So make sure to go into your LiveWELL portal and take that health survey. All right. Some of the objectives for this webinar are to really just have a better understanding of what a plant-powered diet means. Learn some of the evidence-based health benefits of a whole food plant-based diet, which is a very specific diet, and learn how to add more whole foods into your current diet and really explore some of the resources that are available to help support your efforts. And then at the end, again, in order to receive the incentive credit, you're going to be asked to enter a bite-sized goal to incorporate more whole foods into your current diet. So I'll try to share some of those goals, some ideas or suggestions for some of those goals as we go through the presentation today. But feel free to come up with your own goals. What is something really small that you can do to make a difference in your diet? On this next slide, you'll see these beautiful colors of the fruits and vegetables available. They're obviously different tastes and textures that we can't really see through the webinar, but you just know that they're there. I highly encourage you to get curious and really eat the rainbow. Each color has a specific nutrient available with it. So, explore all those colors and textures and taste, in season, when it's in season, really try something new. And we know right now that there's over 7.9 million people in the world that are following a plant-based or plant-powered diet. That's up 550% since 2015. So you may have seen a lot of the commercials lately that are promoting, different plant-based or vegan foods, as they're calling them. So it's certainly a trend right now, and something that is a good, healthy trend that we hope will continue to grow. But what we do want to do is look at some of the different diets defined. A whole food plant-based diet. This is a diet that is you're consuming plant foods in their whole forms, especially fruits and vegetables, seeds and nuts. And those are typically done in smaller amounts. This diet limits all animal products and also restricts the total amount of fat. So the evidence-based research, when we get into that in a little bit, is based on this very particular diet. It has been proven to reverse heart disease, reverse diabetes. It's had a lot of health benefits to it, but it is a very strict and very specific diet in order to get those benefits. The next diet there is vegan. So this is somebody that just really excludes all animal products, or their diet excludes all animal products. They don't necessarily restrict fat or sugar or limit to just whole foods. So you could actually have a junk food vegan. Not all vegan foods are necessarily low fat or even healthy, but they are free of animal products. So that is the difference there. And then you have a raw food vegan who is the same as a vegan. They don't eat any animal products, but then they also don't cook what they do eat over 118 degrees Fahrenheit. And then we have the vegetarian diet. So this diet eliminates meat, and that's all meat: red meat, pork, chicken, and fish. However, they do allow for dairy and eggs. And then you have your lacto-vegetarian. So this diet eliminates meat and eggs, but they do allow for dairy. Your ovo-vegetarian eliminates meat and dairy, however, they allow eggs. And then you have your pescatarian. This excludes all meat, all dairy, and eggs, but allows for fish. And then you have another subset of diet, the Mediterranean diet. This is also a very heart health diet. It's similar to the whole food plant-based diet, but they do allows small amounts of chicken and dairy and eggs and even red meat once or twice a month. This diet encourages fish and also allows for olive oil, so it doesn't restrict fat the way the whole food plant-based diet does. And then you have another completely different subset of diets, which are more of your fad type diets, your paleo diet, your Atkins, and the keto diet, which is also very trendy right now. These diets include meat and seafood and eggs. They also include nuts and seeds, but in a more limited amount, and also limits the amount of fruits, vegetables, and grains. So the important thing here is to remember that these are textbook definitions. I encourage you to look at all of your options and don't necessarily limit yourself to a label. Piece together a diet that works for you. What you want to find is something that makes you feel full and satisfied, also that helps to improve your health, and something that you can continue for a lifetime. That's where some of the fad diets are a little misleading, because it's not necessary. You may see some changes in your health or in your weight if that's something that you're looking for, but it's not something that you can continue for a lifetime. So it's also important to not think of it as all or nothing. You don't have to, again, commit to a very specific label. I'll never have meat again, or I'll never, have this or that again. Because a lot of times when we commit to that, it limits us from taking that very first step, that little bite-sized step. So with diet, again, look for something that works for you. Piece together, different things that go with your preferences and your tastes, and what your body needs. Be cautious of the fad diets, again, because a lot of these are not backed by long-term solid research. You want to check to see who funded or who sponsored any research that is attached to it or that funded the diet. And a lot of times it ends up being a marketing for a book or a particular food group, or a company that is associated with that food. So just be cautious of it. How do you start making some changes here? Well, really, you just make it simple. You start with a base of plants, so your fruits and vegetables and your grains. You fill up your plate with that first, again, including that variety of colors, because that's where all of your nutritional benefits come from. And then you start making those small changes to customize to your own preferences or needs. So maybe you start looking at meat as more of a side dish if you're not ready to completely give that up. Look at any of those animal products as more of a side dish instead of your main course. Really fill up your plate with fruits and vegetables first. And look at your current plate today. So what is something on your plate that you can go ahead and change? What's one small thing that you could change today? That would be a bite-sized goal. So the benefits of a plant-powered diet, again, the research that we look at for the most beneficial reduction in disease and benefits come from the whole food plant-based diet, but adding fruits and vegetables at any amount to your current diet is going to give you some benefits. So again, what is something that you can do today? What's one small step, one fruit or vegetable that you can add to a meal today to start making a difference? So what we do see is a reduction of obesity, diabetes, heart disease, blood pressure, an increased lifespan, a reduction in any inflammation-related diseases or condition, also a reduction in risk of certain cancers. There's a decreased sleep issues, also just overall better gut health. Increase in whole foods at any level is going to give you a benefit. You're going to see a difference in your energy, and then there's also even been some research with how fruits and vegetables and a more whole food type diet can affect your mental health. So first, let's look at obesity. Typically, if we have a 55-year-old, whether it's a male or female, who follows a vegan or a vegetarian diet, they are going to weigh about 30 pounds less than that same person who follows the standard American diet. And a lot of the reason for that is your diets that are higher in fruits and vegetables, your plant-powered diets, are high in fiber, and that fiber makes you feel full, so you eat less total calories, and that total less calories equals weight loss. And speaking of fiber, that may be another goal that you want to consider, tracking your fiber. How much fiber are you getting in a day. The average American needs between at least 25 grams, 25 to 30 grams of fiber. So maybe just start tracking and see how much you're getting and where you can start making some changes to add more. And then I love this next slide here. This is an example of what 500 calories looks like in your belly. So if you look at the far left there with the oil, 500 calories of oil does not take up very much space in your stomach. So you're still gonna, be hungry after that. Also, it has very little nutritional value other than just fat. And then when we get to cheese, you may have a little more nutritional value with a little bit of calcium and protein, but still not taking up a whole lot of space. Same with the meat. You're getting a little more nutritional value there, but you're still hungry on 500 calories. When you look at your starches, like your potatoes and your rice and your beans, and then even at the far right on the fruits and vegetables, 500 calories, you can really get a lot of bang for your buck there. You can eat a large quantity of food, get the maximum nutritional benefits, and fill up your stomach, so you're not going to be hungry. You're basically just optimizing your nutritional intake there. And that is why following adding more fruits and vegetables is going to help keep you not only lean, but also satisfied. So again, you're getting more bang for your calorie buck. And another thing to remember when you start adding more fruits and vegetables is you can eat more of them, but you can certainly have the benefit of reducing your weight if that's a goal for you, but you can also maintain your weight or even gain weight with a whole food plant-based diet. You would just increase the number of calories and eat more of the higher calorie whole grains and nuts and seeds. All right, so this next slide here indicates a case study. There are thousands of case studies that people receive, are seeing some life-changing results. This man in particular is 62 years old. He has high blood pressure, high cholesterol, and type 2 diabetes. And he was taking 7 medications, including insulin. So he didn't need to lose weight, but he just felt bad. His diabetes was out of control. He was on all those medicines. His provider advised him to start a plant-based eating routine or regimen and exercise twice a day for just 15 minutes. So after 16 weeks on a plant-based diet, he was able to wean off of 4 medications. His hemoglobin A1C reduced from 11 to a 6.3, and his cholesterol dropped from 283 to 138. So he saw a lot of wonderful health benefits there in just 4 months. A lot of people see, or there are plenty of studies that show people that have seen different reduction in their blood pressure and able to get off medications in even as small as 2 weeks. The important thing to remember here is to not stop your medications on your own. If you are able to drop off of a few medications because of your diet changes, that needs to be done under the direction of your provider. And as we all know, if we can use our diet to improve our health, it's certainly more cost effective than taking medications. We're going to look next at heart disease and blood pressure. So there's about a 90% reduction in angina or heart pain in just a few short weeks when you follow a more plant-based or plant-powered diet. Again, a whole food plant-based diet or adding more fruits and vegetables to your current diet, those fruits and vegetables are just naturally low in sodium, and then of course we know that helps to lower blood pressure. Eating more whole foods versus your processed foods will also reduce your sodium intake. And then any weight loss that you may see by adding more fruits and vegetables to your diet can also help to lower your blood pressure. Even as little as 10 pounds can make a really big difference in your blood pressure. There's a great book called Reversing Heart Disease by Dr. Colin Esselstyn. So if you want some more resources, there'll be some available at the end of this presentation. And we'll look now at cholesterol, as that also affects heart disease. Plant-powered diets are naturally lower in saturated fat and contain little or no cholesterol. Cholesterol is only found in animal products. So people that follow a strictly vegan or a whole food plant-based diet are basically consuming a cholesterol-free diet. And what we do know is that our bodies make cholesterol since we are animals, and so we don't necessarily have to eat animals in order to have cholesterol in our system. Natural cholesterol produced by our bodies does help to regulate hormone levels. Another thing with cholesterol is if you increase the amount of fiber that you eat, again, which you would be doing if you increase the fruits, vegetables, and grains in your diet, that increased fiber sort of helps to act like a sponge in your digestive tract and sweep out some of the unnecessarily cholesterol. That's another bite-sized goal that you may want to consider. What is your cholesterol? How much cholesterol are you consuming on your current diet? Maybe start tracking that for a couple of days as one of your bite-sized goals. One of the things here I will say too is that you want to be cautious of, typically when we think of cholesterol, we're thinking of eggs and cheese and hamburgers and things like that. But when we consume products that are made with animal products, you are consuming a product that may have a high cholesterol. So for instance, a piece of cake may have eggs and dairy in the batter and maybe animal fat or lard in the icing. So that's going to increase the amount of cholesterol in it, which, maybe if we just looked at a piece of cake, we would normally associate that with being high cholesterol. So just be aware of the places that cholesterol can hide in your foods. Now we'll talk a little bit about tackling diabetes with plant-powered nutrition. So diets high in saturated fat and cholesterol should be avoided in people with diabetes because they are at a greater risk for heart disease. So if you follow a diet based on vegetables, legumes, beans, fruits, whole grains, this is also low in fat and sugar, so that's going to help to lower your blood sugar levels. And then people with diabetes can often reduce or eliminate their need for medication. Again, this needs to be done under the direction of your doctor, but it's very important when you start making changes in your diet to really follow how your daily glucose levels are trending. Again, plant-powered diets can help to reduce weight, and that can also help with diabetes in as little as 10 pounds. One of the things with diabetes is if you're going to follow if you're adding more fruits and vegetables to your diet, a very convenient way to do that is through juicing or smoothies. One thing with if you have diabetes is just to be really cautious of juicing or doing smoothies until you get a more regulated blood sugar level. Sometimes it can be a little too much too fast, and your body doesn't know what to do with all that extra sugar. So just be a little cautious with that. You can certainly slowly add it back into your diet. Dr. Neil Bernard and Dr. Joel Furman both have wonderful books on reversing diabetes. So just be aware of that. And again, we'll call out some of those more in the resources at the end. Next, we're going to talk about the possible prevention of cancers. So plant-rich diets are lower in fat and higher in fiber. We've already established that. And they also have the phytochemicals along with vitamins and minerals. So these are like your antioxidants, which contribute to a possible reduction in some cancers. One thing we know is that about 90% of all cancers are lifestyle related. Death rates from cancer are 1/2 to 3/4 less in vegetarians versus the general population. Breast cancer rates in countries with plant-based diets or more of a plant-powered diet are much lower than our meat-based Western countries. And then colon cancer is actually much more prevalent in areas where they have very rich, meat-rich diets. Prostate and ovarian cancers have actually been linked to the high consumption of dairy products. So again, just another reason to really add and incorporate all those colorful vegetables and fruits into your diet so you're getting a multivitamin and multimineral in every bite. One of the biggest questions with people that are considering going more plant-based or more plant-powered is, where am I going to get my protein if I'm not eating animal products? If I'm not drinking milk, how am I going to get calcium and vitamin D? What about B12 that's found in animal products? Am I going to get enough iron and fatty acids? And the answer is really yes to all of those. With protein, we get about 2 times the amount of protein we need and about 1/2 of the amount of fiber. So if we could flip that around a little bit, we as a country, we'd be a little better off there. So we're getting a little more protein than we need. We need the extra fiber. So really, we only need about 10% of our daily calories from protein. Some good options here are tofu, soy, quinoa, all kinds of grains. Your vegetables have natural proteins in it, beans, nuts, seeds, lentils, all those things. So it's very easy to get the amount of protein that you need when you are eliminating, or if you choose to eliminate, animal products. And then with iron, so lentils, your dark greens like kale and broccoli, potatoes, both regular and sweet potato, nuts, soy products, pumpkin, dried fruit, all of those are really high in iron. And vitamin D, we get about 90% of the amount of vitamin D we need from the sun. Only about 10% of it comes from our food, and we can get that through fortified foods. We usually associate vitamin D with calcium, but it's also, which we've been kind of told since birth as a young age, is very high in dairy milk, but a lot of the dairy milks are fortified with vitamin D, so you can certainly use those in replacement of dairy milk if you're choosing to reduce the animal products there. And then for the calcium, your dark greens, again, your broccoli, your kale, spinach, those kind of things, your plant milks, figs, okra, soy, those types of things are going to be really high in calcium, a great way to get calcium. Almonds also have calcium in it. Cow's milk can actually impact calcium absorption due to the amount of hormones added to some of the cow's milk nowadays, so that's important to be cautious of. And then vitamin B12, if you are going completely vegan or vegetarian, really eliminating the animal products, B12 is something that you may want to consider supplementing. It's very easy to supplement. You need about 1,000 micrograms a day of that. You can take that in pill form, sublingual drops. There's even injections and things. It's found naturally in nutritional yeast, so that's something that a lot of people that choose to not have dairy use as a taste replacement there, and we'll talk about that a little bit later. And it's also important to remember that when we're talking about fatty acids here, vitamins A, D, E, and K are all fat soluble. So you want to make sure to have a little bit of natural fat, such as avocados or seeds or nuts, in order to really absorb A, D, E, and K into your body. This next slide here just shows some examples of proteins in different plant foods, and then it compares a piece of beef or a bite of beef to a bite of broccoli. Again, don't commit to labels, just consider the sources. And then another concern a lot of people may have is, is this diet safe for kids or pregnant women or seniors? And the answer there is yes to all of those questions. Starting children on a diet rich in fruits and vegetables, you're going to set them up for a lifetime of really healthy habits starting at an early age. We all know as adults it's so much harder to break habits or switch habits the older we get. So, starting your children off at a young age of exploring the taste and the textures and like the natural sweetness and the natural flavors of fruits and vegetables is one of the best things you can do. Women who are pregnant or breastfeeding, they can certainly follow a plant-based or plant-powered diet. And actually, a lot of their OBGYNs may already have them on a sort of plant-powered diet, by avoiding things that are dangerous to their pregnancy, such as certain fishes and certain packaged meats and eggs and things like that. So a lot of them are already pretty much following a more plant-powered diet. Women do need to be sure, if they're eliminating animal products, to be sure to do that B12 supplement under the advisement of their doctor. And then seniors, so we all know the older we get, the higher risk we are for certain cancers and other chronic illnesses. So this group would certainly benefit by eating more fruits and vegetables. And then we get into our athletes. So if you consider, Kyrie Irving and Tom Brady and Venus Williams and Colin Kaepernick, if you consider those athletes, then definitely a athlete can follow a completely plant-based diet, but certainly the added fruits and vegetables help athletes run on more complex rich carbohydrates. Your body just runs better on clean fuel, just like our cars do. One of the biggest things that athletes see with following a completely plant-based diet is a huge increase in their aerobic capacity, which gives them an increased performance advantage. And then the most remarkable thing is the amount of recovery, the quickness of recovery. So they're able to do multiple back-to-back workouts, hard workouts, and because their bodies are recovering so much faster on a more plant-based diet. So how do you start to make the switch to a more plant-focused diet, or really increase in those fruits and vegetables? Just start by making the majority of your meals vegetables, fruits, and whole grains, just like I said earlier with your plate. Fill up your plate with those first, and then use those animal proteins as the side dish in just more minimal amounts until you're ready to give them up, if that works for you. Look at maybe one meal per day, or maybe one whole day per week that you go meatless. A lot of people will participate in Meatless Mondays. There's websites and Instagrams and all types of things with that, with the Meatless Mondays that you can follow. There's even a local place in the Noda area in Charlotte that does free Meatless Monday meals to encourage people to eat less meat. Maybe you pick one ingredient to substitute in your casserole. Maybe you make chili with chopped mushrooms instead of ground beef. So there's maybe something that you're already doing that you could substitute with. Maybe instead of using cow's cheese or goat cheese, you could use almond cheese or cashew cheese instead. Try a cooking class. We've got the world at our fingertips. You can YouTube or Google any type of food that you're interested in and look at different ways to prepare it and make it healthier, or adding more fruits and vegetables and grains to it, and eliminating or reducing the amount of foods that animal products that are in it. And this list here is just some examples of substitution. So if you're looking at meat, again, you can look at legumes, veggie burgers, tempeh, tofu, portobello mushrooms, polenta, jackfruit, avocado. You can use all of those things in replacement of chicken or beef or fish. And then dairy. If you've gone down the aisle at your local grocery store, you've probably noticed that the actual cow's milk has a lot less space there. There's all other kinds of non-dairy drinks now and milk products. So you've got unsweetened almond, soy, rice, flax milk, oat milk, coconut milk, and then there's even vegan cheeses and nut cheeses and nutritional yeast. And then there's some suggestions there if you're going to replace oil in your food. You can use water or vegetable broth or vinegar. And then when you're baking, you can use pureed pumpkins or frozen bananas, dates, date paste, unsweetened applesauce. And then for your fillers, so for stews and soups and chilies and larger dishes, you can use rice cauliflower as a filler, or those spiralized vegetables like squash or zucchini. You can even use shredded or diced sweet potatoes or gourds. Even beets and dried fruits work well there. There's a few tips here for dining out. You can always check the restaurant menu online. If you remember that you're the consumer, so you can always ask for things how you want it. You can order a hamburger. If they don't have a black bean or a veggie burger option, you can always ask for avocado instead of the meat burger, or portobello mushroom is another good substitution there. Same with your subs. Pile up your subs with veggies and your pizzas as well. And it's very easy, as you can see on this next page here, to have all types of ethnic foods on a more plant-powered diet. And those are some suggestions of things to try and maybe some things to avoid. And then for the grocery store, a few tips here. And maybe one of your bite-sized goals is you look at the grocery store produce aisle and try something you've never tried before. You want to try to spend most of your time in the produce section, and then plan your grocery store trip around what's on sale. It does not have to be expensive to eat more healthy or more vegetarian or more vegan, or just adding the fruits and vegetables in your diet. Try to buy things that are in season. If things are out of season and being shipped, they're going to cost more. So shop seasonally. Use your local farmers markets when you can. Try some of the new vegan products. You certainly don't want to have a diet full of processed foods, but a lot of times if you're trying to make the switch from to reduce the amount of animal products in your diet, it's easy. These are some easy options to substitute with. And then these next couple of slides here are going to show the environmental impact of following a more plant-powered diets. Essentially, if we just all ate less animal products, it's going to be better for our environment. So any little small step that you can do is going to make a difference. Some people choose to go vegan or vegetarian for ethical, environmental, or religious beliefs. But again, any small step we can make to reduce the amount of animal products in our diet is going to make a very positive impact on the environment. This next pyramid here shows the whole food. This is a whole food plant-based pyramid. And again, if you're not ready to completely commit to that and want to make changes on your own, I would encourage you to make the changes in the top part of the pyramid. So really filling up eating a lot more foods of the base of the pyramid, your colorful fruits and vegetables and your grains and fiber and starches, and then use the top part of the pyramid to make other changes or to keep those animal products in there if you choose to. And this next slide here shows you some of the resources that we have. There's tons of resources out there. These are some documentaries, some books. The Chana study is probably the oldest book or the one that has done the most extensive research. It's been around for years. And that's where a lot of this information comes from. And also some hard books or ebooks that you may want to consider are How Not to Die by Dr. Michael Greger, Dr. Bernard's Reversing Diabetes, the 21-Day Plant-Based Menu book. I also have some other resources, so feel free to reach out to me via email, and I'm happy to share some of those with you. The Engine 2 Diet Cookbook is a really good hearty meals that are all completely plant-based. And then there's some websites or some links there that are non-sponsored, completely just accurate, high-quality research for following a more plant-powered diet. And then bite-sized goals. So I've tried to throw out a couple of suggestions on there. As we've gone through this presentation, what's something that you can commit to in the next couple of weeks? I will replace 1 meal per day with a plant-powered meal for the next 2 weeks, or I will add 2 servings of fruits and vegetables to every meal for the next 2 weeks. Some small little goal that you can start today to start making a difference in adding more fruits and vegetables to your diet. And so we've now come to the end of the presentation. In order to obtain the reward for personal well-being, you're going to go to your LiveWELL portal. Again, make sure that you have taken your health survey. Click on the Personal Well-being tab and then select the LiveWELL Wellbeing Webinars. And then you are going to select the Plant-Powered Webinar. And then it's going to ask you to answer a couple of questions there, including your bite-sized goal. And this information is what you will need in order to receive the incentive credit. The name of the webinar, again, is the Plant Powered Nutrition Webinar. The name of the instructor is myself, Jill Ashburner. You will put the date of the webinar, today's date, and then the code for the webinar is JA0218. We'll leave this slide up for just a few seconds here so you can jot that information down. And again, remember to enter your bite-sized goal as well. There is also a whole food plant-based Yammer group if that's something that you're interested in. And like I said, there's more resources available, so please feel free to reach out at any point. Thank you for joining us. Live well.